This episode of Ask the Doctors is being brought to you by the Wayne County Government. This public service announcement is a joint effort between Beyond the Church Walls Outreach Ministries and WCTV.
Hi, I'm Patty Brown, a retiree of Alcoa here in Richmond, Indiana. I'm willing to take the shot.
I'm Patty Lamson.
I'm Howard Lamson, and we represent Amigos, the Richmond Latino Center.
I'm willing to take the shot.
I'm willing to take the shot.
I'm Dr. Bendari, physician at Reed Health. I'm willing to take the shot.
I am willing to roll up my sleeves and take the shot. Are you willing to take the shot?
We are willing to take the shot.
Good afternoon and welcome to this edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, and streaming on Facebook Live. If you have a question for the doctors during this hour, please feel free to send your question to our Facebook page, or you can put it on Twitter at WCTV Info. Our doctors once again this week, Dr. Thomas Heath, Vice President of Medical Affairs at Reed Health. Good to see you once again, sir.
Thank you. Glad to be here.
Never mind. Dr. David Jedmore.
You were going to say something snarky, I could tell from the look on your face.
Well, you know, Wayne County Health Officer. Gentlemen, how are you this week?
Fantastic.
I'm great.
You're great.
Yeah, life is good.
Continue from there. Why is life so good for you this week?
Just thinking in terms of the COVID epidemic, I mean, things are getting better. Dr. Heath always says this is a series of curves, and it's always much better to be on the downside of one of these curves than on the upside. The state of Indiana's positivity rate has fallen to 7.5%, and Wayne County is under 6 is 5.9%. So when you've been dealing with 12 to 15% positivity rates, that's a very encouraging number. Our deaths are at 179. I noticed that the state site recently reported 8 deaths, but they were picked up from last December, so they're not recent deaths. So yeah, this makes me happy when I see numbers heading in this direction.
It seems to be happening really not just here. It's across the entire state. What do you attribute that to? I know you probably talked to other health officers around the state. What's making this change?
Well, I think it's very uncommon to see anyone now out in public without a mask, and people are social distancing as opposed to the earlier part of the pandemic. The other thing is, I think a lot of this bubble was caused from the holidays, the 3 holidays we had in the early winter. And we're seeing the downside of that curve. I always get nervous when there's something that causes group gatherings. We've got the Super Bowl coming up. And, you know, traditionally Americans invite all their friends over and congregate and watch the Super Bowl.
My Bears aren't in it, so I don't, you know.
So you're
got nothing.
Well, the Colts aren't in it either, which is sad to say, but we could just talk about football. I feel a digression coming, but I better stay on subject here. So we're probably seeing the downside of that bubble that occurred over the holidays. The one hopeful thing we have going for us are the vaccinations. We're continuing to vaccinate. Reed's continuing to vaccinate at the Kuhlman Center out at the fairgrounds, and we're continuing to vaccinate at the old Elder Bierman building. And one of the at this point, Christine asked me to mention this. Anyone, we're vaccinating age groups 65 or older, and anybody that's having any problems making an appointment, which you can do online by going to ourshot.in.gov. If they're having trouble doing that, they can call the health department, and someone at the health department will help them make that appointment. And that number is, it's local area code 765, it's 973-9245. And we will schedule that person for the first open appointment, whether it's at the Kuhlman Center or whether it's at the Elder Bierman site. But we want to help everybody register. Some people have trouble with going online and making these appointments, but we'd be happy to facilitate that. So I hope people utilize us and let us help them.
Okay. Dr. Heath, are you in as good a mood as this one over here?
I think I am. And
it's contagious.
And Dr. Jamar has extra special reason to be happy because he's telling us before we went live that he's planning on a ski trip out in the West next week. So that would be a reason to be happy about a little getaway, and which I'm sure will be entirely appropriately distanced and
it's hard to get close to somebody on a ski slope.
I would think. But I think very happy about the downward slope and trends in the community. When we get to the statistics, I'll be able to show you that the Reed is also on a bit of a downtrend, not as steeply as I would like. It does not match the state and local statistics for new cases in the community, and that's a little bit bothersome to me. But in general, things continue to improve, and I really think that we have a window of opportunity to get as many people as we possibly can vaccinated, which will help to mitigate the next wave whenever that happens. And there's lots of discussion lately, continuing from last week, the week before, about these variants. There are now 4 variants of concern, as the CDC is calling them now.
You said 4.
4, yes. There's most people have heard about the UK variant and the South African variant, and those two in particular have had some level of testing by Pfizer and Moderna to ensure that their vaccines still produce neutralizing antibodies that will be effective against these variants, and that is the case. But there's a little bit of concern about the South African variant. Does cover it, but it seems to require a little higher level of neutralizing antibody in the system to be as effective. That's a little bit of an inside thing that can be confusing, but this has resulted in both Pfizer and Moderna saying that they're now going to work on the next iteration of vaccine that'll be more effective against variants that are coming. But there are a couple of other variants that are on the horizon. In particular, there's this Brazilian variant that's called lineage P1. That is, if you look at Brazil's curve, you can see that they're actually on an upswing. They're one of the few places in the world that are significantly on an upswing. That's because of the rapid dissemination, transmission of this P1 variant that is causing a lot of morbidity in their country, and it's only a matter of time before that's in other places as well. I'm not aware that that's been detected in the U.S. yet, but it could be at some point, and probably will be. Then the other variant that isn't getting talked about too much is the what's being right now called the California variant. I think it's lineage B1451, and we don't know much about it yet, whether it is going to escape the vaccination coverage or not. And so these are things that still need to be tested. But there are actually thousands of lineages of this. It's just that these 4 in particular seem to be responsible for a lot of cases around the world, and there are specific reasons to be concerned about whether they could potentially be resistant to vaccination. But I heard Dr. Fauci kind of make the the point that what this means is we need to continue to vaccinate, even though there may arise ultimately variants that will require boosters and whatnot, because for these mutations to arise requires live hosts. That requires a pool of vulnerable people to acquire the virus, which requires a live host within which to mutate these variants. And if they can't find vulnerable hosts in which to mutate, then they're not going to. So that's a reason to get as many people vaccinated now as is humanly possible. But there are all kinds of reasons why it's hard to get as many people vaccinated as we would like. Partly it's supply, partly it's just availability of vaccine sites, partly it's people being willing to get vaccinated. So all these factors are slowing down the rate of vaccination we would like to see. Had a phone call this morning with the state about their coming expectations about vaccine supply. Mm-hmm. We've actually had to shut down our appointments, not allow any more appointments at our site for yesterday and today. We will probably have to restrict them for Monday because we are low on vaccine and we'll have trouble covering any new appointments. So if you go online and look for an appointment slot in the county today, you probably won't find one at either of our sites. So that's unfortunate. We don't like to see that happen. But on the other hand, we expect to get 2 trays of Pfizer next week, which will be, that'll be close to 2,300 doses available then, and then hopefully after that the vaccine supplies will open up a little bit. So, we're in a good place, but there are some challenges, I guess is the way I would put it. And we do still have some challenges that we're trying to address to get folks from some minority communities to more adoption in the minority communities. We don't know any statistics in this area. I haven't seen any about how many vaccinees are Black or Latino in particular, but we think they're not high enough. There really should be more. And so we're trying to figure out how to reach those. And we saw a PSA before the top of the show here from some prominent folks in the community encouraging just that. And we want to do some things to try to encourage that further.
The vaccines that you all are getting, are you planning on using those for first shots, or do you have enough people at either one of your locations, because you both have to give the second dose, in the queue that what you're getting needs to be held for those second doses that are coming around? I know a couple of people scheduled to get their second dose this coming week.
There are multiple ways to deal with that question of how to ensure that you've got first shots and second shots. And the way that it is done currently is that the schedules are actually, the state has a scheduling system that manages all of that. And in essence, we cannot schedule more of one type of shot or the other. We just get a supply of vaccine and we're going to be giving it out to whoever's on the schedule. But the state kind of manages the proportion of first and second shots via the schedule. So when you come to our site or you go to the Wayne County Health Department site, that's when you schedule your second shot. But when they're looking at the schedule to put you in, they only see slots that are available for second shots. So that's how they're trying to manage to avoid overbooking vaccination appointments into the future that would run into a mismatch of what is needed for second shots as opposed to first shots.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. We are taking your questions for the doctors. You can do it on our Facebook page, or you can send a question to Twitter at WCTV Info, and we will get your questions in here in just a couple of minutes. Before we move on, want to talk about testing. I heard this week on one news outlet that there seems to be less testing going on since the emphasis has been about vaccinating people. With the variants that are out there, is there a concern that maybe people who might a few weeks ago have been signing up to get testing aren't getting testing? Are we getting as much testing done as we need to do to find out how much COVID is actually still in the community?
Well, the short answer to that is we probably are never doing and probably never have done enough testing. But the testing is down, and I think some of the reasons for that may be the disease is down right now. So obviously, if there are less people are sick or less people are concerned about being sick, they're not going to be tested. And maybe there's some complacency on the part of people because we've gotten, they see vaccines here and feel like we've reached that light at the end of the tunnel, and we haven't. But what are your thoughts, Tom?
Yeah, I think there are multiple factors in the testing. We are no longer constrained by availability of testing capability. We've got plenty of that. But the testing numbers have been down, and that, I suppose you would classify that as the demand for testing is down. And there can be multiple reasons for that. One is that there simply is less disease in the community, so that there are fewer people with symptoms and fewer people showing up to be tested. I mean, you can tell that by looking at the data, because at the same time that all tests have been down, the proportion that are positive is down as well. So if it was just that, the only people getting tested were those who are symptomatic, then our proportion, the testing positivity rate would be higher. But it's not, it's lower. So I think what that just means is that there are fewer people with symptoms, fewer people with concerns, maybe about exposure, maybe about having symptoms that actually is something else, but they go to get tested. There's just less of that. I'm not sure what to do about it. I wish we could see more testing being done, because we know that we've always known that not enough people who should be getting tested for symptoms or because of exposures and so forth probably should be doing it that are not doing it. But I'm not sure how to address that. But it is true that we've kind of turned a lot of our attention to vaccination. That's what we've been messaging about mainly. And that that sucks some of the oxygen out of the room in terms of how many things you can message about.
Yeah, we may be. We've gone crazy trying to get people vaccinated and sent the message out on that, and maybe because people aren't hearing us talk about testing as much, that we may be partially at fault for that, just in terms of the messages we're sending out.
Testing is still available. You all still have the Elder Beerman site where vaccinations are going on.
Yeah.
One end of that room is vaccinations, the other end is still testing?
Yeah, if you park in that parking lot and go in from the south, you're going to be in the vaccination area. If you enter that building from the west, you'll be in the testing area. People can come in, they can make an appointment ahead of time, or they can just come in. The testing's free. If people are wondering, the treacherous part about this disease is half of the people are asymptomatic. I mean, they have no symptoms. But if you're ever in that neck of the woods and you want to know, and you're, waiting for you've got 15 minutes, come in, we'll test you, and you can find out where you're at.
You're watching Ask the Doctors on WCTV, Channel 11. Let's get the first question in and just give these gentlemen a little bit more to talk about. Have any of the variants in COVID-19 been seen in Wayne County? Do the current tests also pick up the variants?
I'm not aware, perhaps Dr. Jetmar knows differently, that we've had any variant viruses identified specifically in Wayne County. I wouldn't be surprised if there have been some that has been identified in the state. It's just that the testing cannot distinguish between the variants. That the testing that we normally do, it requires special gene sequencing and can only be done in certain types of labs. And so the state handles that by taking samples from the sentinel labs around the state and doing sampling on those, and that's how they pick up the ones that they've got. Generally, there may be some other ways. So as far as I know, as I say, we've not had any variants identified here. As far as the testing goes, would that miss any of the variants? I wouldn't think so, just knowing about how the PCR test and the antigen testing work. I don't think the testing ought to miss any of those. But maybe Dr. Jetmeyer knows a little differently, whether the testing is impacted by the variants.
I think the testing picks up all the variants, and I don't know of any of these 4 variants that you mentioned earlier in the show. If any have occurred in Wayne County, they haven't been identified. I think they're sent off to the lab at the CDC to identify these variants. But I would think we would have been informed here, at least at the
I would think
Public
so.
Health Office, if they had identified a variant.
Okay. Let's go to another question. Is it okay to take ibuprofen for side effects after getting the vaccine? I had severe chills and I took ibuprofen and it helped, but afterwards I wondered if it would affect the effectiveness of the vaccine in any way.
I don't think it would affect it in any way, but that's just my gut feeling. Do you have any thoughts to the contrary, Tom?
I doubt that it would. I don't think this is something that's been specifically studied. I think that there has been, it's one of these things that has achieved a little bit of a mythic status because at some point somebody proposed a theoretically possible mechanism by which the non-steroidal anti-inflammatory agents like ibuprofen might reduce the by reducing immune reaction symptoms might reduce the immune response. But I don't think that's logically works. Just because I reduce some of the symptoms doesn't mean I'm not having the reaction. And so I frequently get this question, should I avoid ibuprofen or other over-the-counter anti-inflammatories? And I say don't worry about it because there's no evidence that they're harmful in any way. We would have been told that specifically if it were the case. And, if you're worried about it, take Tylenol. That worked well for me to reduce the little bit of arm pain that I had after the first shot. But I tell people not to worry about it.
Okay. You're watching Ask the Doctors on WGTV Channel 11. We're taking your questions on Facebook or send them to Twitter at WCTV Info. I've got a slide in front of me, and I wanted to give you a chance to talk about a couple of things. One of them is encouraging people to donate convalescent plasma,
yes.
Which is one of the things that you were talking about a few weeks ago. Again, as we talk more about the vaccines and things of that nature, some of the other conversations slipped by. Wanted to know if there was anything you wanted to throw out there as far as people being able to donate that, how much of that you all need. Are you getting people just signing up to be able to do that?
Yes. With the next question, no. It actually the data on convalescent plasma use has kind of gone a little bit back and forth over time. Probably the latest information is that we actually think it's probably more helpful than we even could recognize, and it's more helpful the earlier it's given. And so the protocols now for convalescent plasma use actually recommend giving it even earlier. It used to be that we would reserve it for those who were like critically ill in the ICU on ventilators, but we think it actually works better if it's given to people at high risk when they're not that sick. That's some data that's been emerging and is kind of changing the minds in the expert community on this. Now, convalescent plasma requires that somebody have, neutralizing antibodies in their system. They need to be, typically it's been people who are recovered from active COVID-19 infection. I am hopeful that they'll accept people who have neutralizing antibodies from vaccination, but I don't know for sure whether the blood center will accept that. I think some places may not, but I can't think why there'd be any reason why you wouldn't. And people who are vaccinated have high levels of antibodies would make a great pool of donors, in my mind. I donated whole blood just this week, and I'm expecting to hear back because they're testing everybody for antibodies because they're trying to recruit from that pool. And I expect to hear back on that. Hopefully I've got antibodies and they'll take me in as a plasma donor. We do take plasma donations when we have blood drives now at Reed. We weren't always able to do that, but we are now. And we do need more people to donate. We've only a couple times been denied the ability to get plasma when we needed it, but that's always something that may be in short supply. So we have information at our webpage. If you go to readhealth.org, at the very top, it has a little banner, clickable link for, it's called Safe Pathways. If you go to that, there's all kinds of COVID-19 information along the side particularly, and one of the links is to how to donate plasma. Now that therapy, convalescent plasma, that is antibody rich, is a strategy that you would call passive immunization. So we're not relying on patients to build up immunity over time. We're giving it to them all in one blast. And hopefully that fights off active infection. But the other strategy that we use for that is monoclonal antibodies, you mentioned in the question. And we have 2 infusion sites that are doing that. That is for people at high risk who have a positive test for COVID-19. They're having symptoms, but they're not very many symptoms. And we know that that's a great time to intervene. And again, the data is the earlier we do that, the better. We're not doing as many of those lately. We are still doing them, so at least a few every day. And, but we're not using that enough. Even though the numbers of new cases in the county are down, we still know that about a third or more are people over the age of 70 who, just by virtue of age, will qualify for treatment with monoclonal antibody. And, only a fraction of those are actually getting plugged in for the treatment. So we want people to be aware of it, utilize that, and we think that's a great way to reduce the risk of hospitalization and consequently worsening to critical illness and need for or to have respiratory failure. We think we can prevent all of that by intervening early enough. So I'm glad you brought that up. We want to make sure that that's still out there, and we don't only ever talk about vaccine. We still are going to have people with active infection, and we want to get to them. Now, the other iteration to that I've mentioned before is that we've the highest risk patients for complications for COVID-19 are those who reside in long-term care facilities. Far and away, the burden of severity of illness and death is borne by them. But it can be very, very challenging to get them to these types of treatments, to monoclonal antibody in particular. So we now have a team who will go out into facilities to transfuse in place. And what we need is to have pre-existing relationships with all the long-term care facilities to be able to react quickly, because there's some setup has to be done beforehand to be all ready, and then we can get in there and do things within hours if we have it all set up. We've done that successfully in a couple of facilities here locally, and in one case we infused 25 people, and in another facility there were 4. So, we've seen very few hospitalizations out of that group, which you would expect a lot of them would get sick enough to need to be hospitalized. So it seems like it works, and I wish we could do it more, because I really think that's going to really inflect our statistics a whole lot if we can do those types of things.
Because I know that the folks who watch the show are kind of interested in you all's thoughts. It was mentioned this week that the federal government, beginning I think next week, is going to start to send some vaccines out to various pharmacies around. Give us your thoughts on that, considering that you're both saying we could vaccinate more people if we had more vaccine. Do we run the risk of, at this point, kind of stretching this so thin that maybe we're not being as effective as we could be? I mean, you're shutting down for 2 or 3 days the number of people that you're able to take into your site. Shouldn't we begin to fill your sites and then handle overflow in other places? Just as a question.
I think it's all right, that strategy. I think in the short term, you know, here we are talking about not having enough vaccine for the 2 sites we have. These pharmacies, you know, for years have been giving, you can go there and get a flu shot. You can, they're already been given the task of vaccinating long-term care facility residents in our county. I think once all of these vaccines come online, I think this is going to take off once all of these other vaccines get emergency use authorization from the FDA. We're going to be able to utilize all of these sites. Then again, there are many people that are probably comfortable at their drugstore. They know where their pharmacy is. They know the people there. They gave them their flu shot last year. So those people might otherwise stay home rather than go get a vaccine. So there's that factor too. What are your thoughts?
Yeah, I mean, I think just conceptually we can agree that making vaccine available anywhere and everywhere that we can interact with people is a good thing. I would say that I think the argument's probably more about the timing rather than the concept. It's because we do have the capacity at Wayne County Health Department, as an example, for probably 2 or 3 times the number of vaccines that you're currently able to do. And it's the same for our site at the Kuhlman Center. We're doing, you know, some in our neighborhood currently about 300 a day. And we could easily do 13 to 1,500 doses a day, but we can't get enough vaccine for that. So I think the time to disseminate it out and maybe into every pharmacy on every corner is after we've got enough to fill the sites that are capable of large volume vaccinations, in my mind. At the same time, I could see that there may be places in the country that don't have a readily accessible county health department site or a big site like Rita's done. And maybe there are little pharmacies here and there in small towns in Montana or Utah or whatever that could fill that gap. So I can kind of see it both ways, but I think I'd prefer the feds had waited until we had enough vaccine to supply the currently existing infrastructure and then say, how do we broaden that infrastructure rather than the other way around.
Okay.
You're right, the timing could have been better. I think the concept is good. The underlying problem with this, as it is all over the world, is there's just not enough vaccine.
You're watching Ask the Doctors. We're taking your questions on our Facebook page as well as on Twitter at WCTV Info. Let's bring up the next question. This week, vaccine cohort 65 plus started. When will the next cohort be 60 plus or another group?
Well, the next cohort has been predicted to be 60 plus. The state hasn't announced yet when that will start. The 65 plus cohort started on February the 1st. And I don't know how these decisions are made, but we're just informed, yep, this cohort starts on this date, so, and we comply. But,
I think it has to do with the decisions are really made based on what they think the supply that they're able to get from the federal government and the manufacturers is going to support. The 65 plus went into effect, on February 1st, but that was a week later than we thought it would be, and I think that was delayed because of supply inadequacy.
Are you aware of 60 plus being announced yet?
No, it hasn't been announced, and so right now with us, they seem to be kind of playing that kind of information a little bit close to the vest, which I understand. You know, if they start talking about one thing, then if they don't follow through on it, then it makes them look like they don't know what they're doing. So We all
Wouldn't
expect
want government to look that way,
60
would we?
plus to happen. Maybe it's next week.
That would
Maybe
be
it's the week
horrible.
after. We can have a betting pool on it, perhaps. But I think that would be no more than a guess at this point. Exactly when that will happen. But the other, I also sense that they're at some point, whether it's after, whether it's before or after they start saying 60 plus, regardless of underlying conditions, I know that they want to try to get into certain populations at high risk who've not already been covered by the age categories. For instance, in particular, I hear them mention over and over about dialysis patients. They're actually a pretty high risk, regardless of their age, they're a pretty high risk of not only contracting COVID-19, and once a patient gets it and then, they have to be dialyzed, then there's problems of spread related to the dialysis center as kind of a center point for that. So can be very challenging for the dialysis community. And then simply because of their underlying conditions, they're at much higher risk of becoming critically ill. So I know that they want to get into the dialysis patients sooner rather than later is kind of an early important area of theirs. Some other groups that have been talked about, but it would include like teachers or educational communities, but I still hear the state of Indiana kind of resisting that. I know that there's a lot of political pressure or public pressure to do that, but on this week's call with the governor to kind of reiterated that's not where they plan to go anytime soon. Nevertheless, in Ohio, that's exactly what they're doing. We hear once or twice a week on phone call that we have, Dr. Jetmore and I have, with all the area health departments, including a couple in Ohio. We hear from the Ohio folks about how they're trying to roll out to the school systems there, and whether that will happen in Indiana, I can't guess.
Okay. Let's go to the next question. When do people that have chronic illness like lung disease get their vaccine and their spouses that care for them?
Well, that's not been decided at this point. I think the state's kind of proceeding by age groups based on the assumption that on the knowledge that 80% of the deaths in this state occur in people that are 60 years old or older, so the state's taken that tack. Now, having said that, someone might be 50 with chronic lung disease and other comorbidities and be much more likely, much more at risk than say a healthy 70-year-old. These are hard decisions. And those people need to be vaccinated. They need to be vaccinated before many others, but that decision specifically has not been made yet by the state.
And I think that there's a logistic challenge with how to ascertain that. It's pretty easy to define things on age by age because I've got a driver's license that has my birth date on it, and I can pretty easily show whether I'm 65 plus or not. But how do you decide what comorbidities, what combination of comorbidities, how that's to be proved and validated? Because even with the age thing, there are just lots of people who are trying to work around that and get in for vaccines. So to me, it's probably one of the reasons why they've hesitated to pull the trigger on anything related to comorbidities, because it's like, how do you manage that and validate?
And is your comorbidity more severe than my comorbidity?
Yeah.
How do you graduate?
We may both
that?
have the same comorbidity in name, but you could be at higher risk because you got a much more severe case.
Mm-hmm.
Just to take the lung disease as an example, there's not just COPD. There's some people have very minor degrees of it, very minor symptoms. Some people are very, very severely affected. Where do you draw the line in there? It's a spectrum. There's no bright lines. So I would hate to be in charge of figuring that out because it would be really hard.
Next question. Have you seen many side effects to the second vaccine shot? I've heard the second shot is much stronger.
I've heard the same thing, although I've not, but I've only heard this really anecdotally. I'm not really aware of any study where people were questioned about the side effects they had from first or second shots. But I've heard of some anecdotal cases where people told me they weren't bothered much by the first shot, maybe just a little shoulder soreness, but then with the second shot, maybe they had a headache or felt achy for 24 hours, things of that nature. What are your thoughts, Tom?
Yeah, just to let me clarify one thing about the question so that everybody's on the same page. I understand what the questioner is asking, but the second part of the question was, I've heard the second shot is much stronger. Just so we're all clear, the second shot dose is exactly the same as the first.
Yeah, I interpreted that to mean the stronger symptoms.
Yeah, the severity of reaction is possibly stronger with the second. Well, in the national studies, the ones that the vaccine makers submitted for approval, both for Pfizer and Moderna, I haven't seen Johnson & Johnson's information yet. That was the case. In general, there were more symptoms after the second shot than the first. But I can tell you, we've seen everything all over the map from people who had no symptoms at all after the first, who had a lot of symptoms after the second, people with a lot of symptoms after the first, and virtually no symptoms after the second. So you can take the average case, but nobody's exactly the average. Everybody's somewhere else on that spectrum. And Dr. Jetmore and I had hardly any symptoms. A lot of people I know didn't, but we know many people who did. I think most people should expect to have some degree of symptoms, and they can be more severe or more stronger symptoms, I guess you would say, after the second shot. And, so you just have to be prepared for that. That's not bad. That's not dangerous. You could make an argument that that's a sure sign that your immune system is reacting, and so you should be reassured by that. And but there is one side effect or symptom like that it's classified as a minor symptom that we've become aware of that's maybe a little more frequent than we were expecting, and when it happens, it sometimes surprises people. And that is swollen lymph nodes under the arm or on the side of the neck, on the side where the shot was given. And that's in the literature. You look at all the potential side effects that's in there, lymphadenopathy it's called. But some people are really noticing that, and they're getting concerned, and we've gotten questions about that. Just know that can happen. It's not dangerous. It's in the same category as the low-grade fever or headaches, muscle aches, and it goes away after a period of time. That it may take a week or two, but using Tylenol or Advil is perfectly fine for that. And don't panic. It's to be expected in some people. The one thing to know is that this actually was kind of brought to the attention of everybody because the radiologists who do like mammograms, they often do a breast exam as a part of that at the same time, or they'll do an ultrasound test and so forth. They were picking them up when people weren't aware of it themselves. And so it's just good to be aware that, if it comes up in the context of a regular breast screening exam, just know that a recent COVID shot might cause that. So no reason to panic. Just maybe watch it over time and make sure it goes away. Or you could make a case for maybe scheduling your breast exam for a little bit longer, maybe a month or more after getting the second shot, just to make sure that that's not going to be an issue.
You're watching Ask the Doctors on WGTV. Our doctors, Dr. Thomas Heath from Reed Health, Dr. David Jetmore, the skiing one, from the Wayne County Health Department. Once again, gentlemen, we appreciate the time that you give us every week. We've got about 13 minutes left in the show. We want to get one more question in, and then we'll turn to you to take a look at the numbers for this week. So let's get another question up. It seems like the percentage of positive cases has been up in the school age group. Any idea how many school children are out sick?
You know, I don't have an answer to that question, and I'm not really aware that the number of positive cases within the school age group is up. If Christine was here, she might have those numbers. I can check with her, but
I saw a picture last night that there were cheerleaders and band members at a game. So
Yeah.
that's a good thing with the numbers coming down.
yeah, because the numbers have come down so much, we've loosened. We weren't allowing cheerleaders, and we kind of liberalized the rules regarding cheerleaders, and we're thinking about liberalizing the rules in terms of the number of people that we were just letting 2 people per athlete attend those games. But you know, we're on the verge of we've been orange for for a long time. We're on the verge of dropping down into yellow, just one stage above blue. I don't think it's been 30 years. It seems like 30 years since we've had a county that's been in the blue. But
30 coronavirus years,
yeah,
yes.
30 coronavirus years. That's right, which are equivalent to. Never
Exactly.
mind.
So things are turning from where you're seeing them.
Yeah, well, from what I'm seeing them, it seems like everything in the county is decreasing, including cases within the school district. You know, at this point, I need to give an attaboy to all our teachers and educators in this county. They've done an incredible job, and I wish I could vaccinate every teacher in this county, but that's not where the state's going. We're going by age groups, but they've done a fantastic job, and those children being in school and getting in-person teaching is so important. So important to those children, and so important to their parents, so important to us as a community. So they need to be. The next time you see a teacher, give them an attaboy from a safe distance.
And I don't know where this the questioner gets the information about the percentage of positive cases, but it could be from the state's website. You can configure the way the state graphic works to look at total tests by age group and positive cases by age group and hospitalizations and deaths by age group. And basically, if you do it by total tests and you do it by positives, it seems to be weighted towards younger age groups, including the school age groups. But if you configure it for hospitalizations, deaths, it's very strongly the highest age groups, particularly 60 and above. So I think it's good not to focus so much on the positives in the younger age group, but really what that implies in terms of risk, which is not very much.
No. The mortality rate for children in that age, younger children, is the same as the mortality rate from the flu we have each year. I think it's a fraction of a percentage point.
Let's take a minute. We've got probably about 8 minutes left to go. We want to make sure that you have some time to talk to us about where we are from a numbers standpoint, and then maybe get 1 or 2 more questions in before our hour is up.
Of course. So this first page is the Wayne County statistics, and if you guys can zoom into the lower right, the last bar on the right, and basically that's the current week in progress. Through yesterday, there were 86 positive cases in Wayne County. And I hope this isn't too complex, but the other numbers there, the 120 is what that projects out to what we should have. We should finish the week at 120. And then my 95% confidence interval is the other numbers. We should wind up between 109 and 132 cases, just doing the math on it. Now, I will say last week I had said that we would be between 170 and 190, and we came in at 174, so that makes me 3 for 4. Just in case you're keeping track.
You should congratulate yourself, and I do keep track every.
I do that every 5 minutes.
You should have bought one of those big lottery tickets.
If only I had that much luck with the lottery. And then the second page is the Wayne County deaths, and I think all in all, the Wayne County is 179 deaths, I think was what the app showed this morning. It could be a little different at this moment. We should have since October 1st, 186. We've only had 164, so we continue to have good luck in terms of deaths running below what the average would be for the state for the number of cases over age 70. So we're doing a good job as far as that goes, even though that we don't like all those deaths. Last page is the Reid statistics, and again, the important one is the last set of bars way to the right. You can see that Reid's numbers have come down from the peak, but they've been kind of plateaued-ish, maybe slightly downsloped. I referred to this earlier. It is really not tailing off as rapidly as the county statistics, the state statistics, and that's a little bit bothersome to me. So we still have quite a bit of significant illness. I mean, the total cases are way down, but the serious illnesses, serious enough to be in the hospital, are still significant.
And these lows are higher than they were in the spring.
Yeah, these lows are, they're definitely higher. But, you know, now that we've come off the high, it's all about in comparison to, you know, so we feel better about where they're at any rate. And one thing I wanted to mention, Eric, last is to schedule, and next week our schedules will be wide open again, and you could call today and get scheduled. It just will be for sometime next week. But the 211 service has a little bit of an issue, complex stuff that happens behind the scenes. But if you just simply say I'm in Wayne County, they won't tell you about the Kuhlman site. And it's not that anybody's bad or doing anything wrong. It's just a complexity of way their view of the sites looks. I won't get into that detail. But what I will say is if you use 211 to schedule and register, ask specifically for Wayne County Health Department or Kuhlman Center. That way you will be sure to be told about appointments that are in Wayne County.
Okay.
And you can also call our office directly, 935-8484. I should have had Judy make up a graphic for you. 935-8584 gets our site at the Kuhlman Center directly. The folks there can schedule either Kuhlman Center or the health department, whatever's most convenient.
And if you
there
call,
it is, 935-8484.
Yeah. And if you call the health department at 973-9245, they'll help you make an appointment, and they'll get the first available appointment for you, whether it's at the Kuhlman Center or whether it's at the Elder Bierman site.
Okay. We've got a little bit less than 4 minutes, and we're going to try to sneak in another question for you gentlemen before we go. Once you have been fully vaccinated and find out that you have been directly exposed to COVID, should you still go into quarantine and get tested?
I hadn't thought about this question.
And a hush falls
Tom's
over the
not
room.
jumping on it, so I'll take this one. Once you've been fully vaccinated, you still have even with these excellent vaccines, you still have a 5% chance of becoming infected. The vaccine isn't 100% effective. So theoretically, you could catch the COVID virus and transmit it to someone else. Having assumed that, I suppose you probably should isolate. What are your thoughts,
you would
Tom?
think that you wouldn't have to,
Yeah,
however.
I know.
Because if you've had actual COVID-19 infection within the last 90 days, you don't have to. That's the way the system is set up. They've not opined on what to do after vaccinations.
No.
So I think if you were identified as a close contact today and you had been vaccinated and you got into the contact tracing system, you would probably still have to quarantine and maybe test.
Even though the chances that you would not have the disease are minuscule.
I have a feeling that as we get significantly more people vaccinated, they'll change that rule,
Yeah.
possibly. And by the way, Eric, we've had over 10,000, it's probably closer to 11,000 vaccinees through the Reid system today. I think it's another 2,000 to 3,000 from the Wayne County Health Department. And in the surrounding health departments, it's probably another 3,000 to 4,000. So we're actually getting quite a few people vaccinated locally.
Okay. And there have been cases where we saw it in Congress where there were congresspersons who had been vaccinated but still got COVID. Is there a lag time in that? I think I heard something about, and we've got 2 minutes left, that there's kind of a lag time for when that second dose really kicks in and you're really fully vaccinated. It's a couple of weeks or something?
I've heard and read many places it's 2 weeks after the second vaccination when your immune system is at its peak. Does that sound?
Yeah, that's exactly what we say.
Okay. Gentlemen, once again, your time, I know, is incredibly busy. We appreciate you taking it every week to supply some of the information to the community. Dr. Thomas Heath, Vice President of Medical Affairs at Reed Health, Dr. David Jetmore, Wayne County Health Officer. Gentlemen, thank you very much for time. Greatly appreciate it.
It's a pleasure.
Thanks for having us.
They have given you a couple of numbers. Don't forget that if you need help getting scheduled for a vaccine shot, there is the number there at Reed that Dr. Heath gave you. 935-8484 is a number that you can do that. The Wayne County Health Department has another number that if you are in need of assistance with getting yourself scheduled, 765-973-9245. Correct me if I just did that incorrectly.
It was perfect.
And of course, you can do it online if you have that ability, and not everybody in our county does. But if you have the ability to go online and get yourself scheduled, it's ourshot.in.gov. And of course, if you're interested in donating COVID convalescent plasma, you can do that Fridays at Reed Health. You can call 973-461-3220 or visit giveblood.org in order to be able to get that done. We'll be back next Friday for another edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11. Thanks for watching. I wish you well. This episode of Ask the Doctors has been brought to you by Wayne County Government. This public service announcement is a joint effort between Beyond the Church Walls Outreach Ministries and WCTV.
Hi, I'm Patty Brown, a retiree of Alcoa here in Richmond, Indiana. I'm willing to take the shot.
I'm Patty Lamson.
I'm Howard Lamson, and we represent Amigos, the Richmond Latino Center.
I'm willing to take the shot.
I'm willing to take the shot.
I'm Dr. Bendari, physician at Reed Health. I'm willing to take the shot.
I am willing to roll up my sleeves and take the shot. Are you willing to take the shot?
We are willing to take the
Take
shot.
the shot.